What is a bunion and what creates a bunion? What should people be looking out for that?
Yeah, once again, we'll refer back to our model for that because it'll help explain that. So a bunion is a deformity of the first metatarsal. So this bone right here. So what happens is that starts to drift over like this, and then the big toe starts to drift the other way like this. And we get this big bump that sits on the side here. And that can happen for multiple reasons. Once again, it can be genetics, it could be trauma, it's typically could be muscle imbalance. Those kind of things can make a big difference in developing of the bunion. And everybody says, well, is it going to get worse with time? Most of the time, these will get worse. They're a progressive sliding of the metatarsal, that bone out of position, causing that big bump on the side of the foot. It can be very painful because there's a nerve that runs right along the side of that particular bone.
Okay.
And if it gets bad enough, then it's a more aggressive procedure in order to fix that problem. I always tell people, or they ask me, when should I have this fixed? And I usually tell them, when it hurts and you can't do the things that you enjoy doing, that's probably the best time to have it done. When you're not having any pain or discomfort, we just watch and monitor unless they say, I want it fixed now because it'll probably be easier to heal from and be able to get back on my feet faster now than 10, 15 years from now. Okay. And so it does require sometimes just shaving a little bit of the bump off. Most of the time it requires actually cutting through the bone, or what's called an osteotomy, and moving that bone back into position. And usually you have to put a couple of screws in for that because you're kind of creating a fracture to fix the deformity.
Okay.
And that's the healing part, which takes about 4 to 6 weeks before I typically will let my patients walk on them.